Online doctors for Suboxone prescribing. If you are an opioid addict seeking a Suboxone prescription, you may wonder where to turn. You may be concerned about the stigma associated with addiction and don't want to go through your regular doctor. You may also be worried about the cost of treatment for addiction. The good news is that there are online doctors who prescribe Suboxone for opioid use disorder. In this video, we want to talk about online doctors for Suboxone prescribing. We will discuss how to find an online Suboxone doctor, what to expect when starting Suboxone treatment, and how long Suboxone treatment usually lasts. We hope that by the end of this video, you will better understand online doctors for Suboxone prescribing and whether this treatment option is right for you. Let's get started. Suboxone is a medication used to treat opioid addiction. It is a combination of two drugs, buprenorphine and naloxone. Buprenorphine is an opioid partial agonist which binds to the same receptors in the brain as other opioids but produces less intense effects. Naloxone is an opioid antagonist which blocks the effects of other opioids. Suboxone use is part of a treatment program that includes counseling and behavioral therapy, making it more effective than buprenorphine or naloxone alone. Suboxone is typically started when a person no longer uses opioids and is in withdrawal. Suboxone helps reduce withdrawal symptoms and cravings, making it easier for people to abstain from opioids. Suboxone is FDA approved to treat opioid addiction. It can be used to detox from opioids or manage cravings and withdrawal symptoms in people trying to abstain from opioids. Suboxone use is also part of a long-term treatment plan for opioid addiction. Suboxone use is not meant as a short-term fix for opioid addiction. It is essential to talk to your doctor about whether Suboxone is right for you and develop a plan for tapering off the medication if you decide to use it. Suboxone should not be used by people still using opioids, as it can lead to withdrawal symptoms. It is also not recommended for people who are pregnant or breastfeeding. Suboxone is also used to treat both acute and chronic pain. It can be used as an alternative to opioids or in combination with other pain medications. Suboxone is not meant for long-term pain management, but it can be helpful for people trying to reduce their reliance on opioids. Suboxone is a Schedule III medication. It has a moderate potential for abuse and dependence. And, because of its potential for abuse, Suboxone is only available through a certified physician trained in its use. Suboxone is typically prescribed as a sublingual film or tablet, which dissolves under the tongue. It can also be prescribed as a buccal film, which dissolves between the gums and cheeks. The medication is usually taken once a day, but the dose may be modified depending on how well it works. Suboxone treatment typically starts with a lower dose and then increases as needed. Following your doctor's instructions when taking Suboxone is crucial. You must not change your dose without talking to your doctor first. Suboxone should not be abruptly discontinued, which may lead to mild or severe withdrawal symptoms. If you want to stop taking Suboxone, talk to your doctor so they can help you taper off the medication slowly. Despite the many uses and effectiveness of Suboxone, it does not come without side effects. The most common physical side effects of Suboxone include nausea, dizziness, and vomiting, headache, drowsiness, dry mouth, excessive sweating, irregular heartbeat, back pains. These side effects are typically mild and go away on their own. However, you must talk to your doctor if these side effects persist or become severe. Many would say it takes them up to 2 weeks to adjust to the medication, so it is essential to be patient when starting Suboxone. Suboxone can also cause psychological side effects, such as anxiety, depression, irritability, mood swings, insomnia. Suboxone can also cause liver damage, so you must talk to your doctor about your medical history before starting the medication. It also interacts with many other medicines, so you must tell your doctor about all your medications before starting Suboxone. Since Suboxone is a Schedule III medication, it can only be prescribed by a certified physician trained in its use. One option is to speak with your primary care physician. They may be able to prescribe the medication or refer you to a specialist who can. Another option is to seek out a treatment facility that offers Suboxone treatment. Most facilities will require an initial assessment before starting treatment, but once enrolled, you can receive the medication through the facility. Finally, many online resources can connect you with a doctor who can prescribe Suboxone. One of these resources is SuboxoneDoctor.com. It makes it easier for people to find online doctors near them who can prescribe Suboxone. If you or someone you know is struggling with addiction, don't hesitate to seek help. Many resources are available to assist you in getting the treatment you need. Finding a Suboxone doctor online is easier than ever with our platform. Our website maintains a directory of doctors certified to prescribe Suboxone to treat opioid addiction. To find a Suboxone doctor near you, enter your zip code into the search tool on the website. It will present a list of doctors in your area and their contact information. Once you've located Suboxone doctors that you're interested in working with, you can compare their profiles and choose the one you feel is the best fit for you. After choosing a doctor, you can contact them directly to schedule an appointment. Suboxone treatment can effectively help people break the cycle of addiction, but it is not suitable for everyone. If you are considering this treatment, you must consult a doctor or addiction specialist to discuss whether it is right for you. Many factors need to be considered, such as your personal medical history and addiction severity. Suboxone is not recommended for pregnant women or those who are breastfeeding. It is also not recommended for people with certain medical conditions, such as liver disease. With the help of a professional, you can make an informed decision about whether Suboxone treatment is right for you. MIT, or medication-assisted treatment, is a comprehensive treatment approach for substance abuse disorders that combines medication with behavioral therapy and counseling. Suboxone is MIT medication used to treat opioid dependence. When starting Suboxone treatment, patients can expect to undergo an initial assessment to determine if MIT is right for them. If MIT is deemed appropriate, patients can start on a Suboxone regimen tailored to their individual needs. Suboxone treatment typically involves regular visits to MIT provider for monitoring and support. In addition, patients must participate in weekly counseling and behavioral therapy sessions. With commitment and dedication, MIT can help patients overcome addiction and achieve lasting recovery. Suboxone is a prescription medication used to treat opioid addiction. It is a long-acting medication that stays in the body for an extended period. Most people who take Suboxone will need to continue treatment for 6 to 12 months, although some may need to stay on the medication for longer. Patients typically see their doctor weekly for counseling and checkups during treatment. You can usually start to reduce your dose of Suboxone after 6 to 12 months of treatment. At SuboxoneDoctor.com, we can help connect you with an online doctor who can prescribe Suboxone. Suboxone is a medication used to treat opioid addiction and can be an effective way to overcome addiction and achieve sobriety. The first step is to visit our website and complete a short questionnaire. Once we have your information, we will match you with a doctor who can best meet your needs. The doctor will then conduct a consultation with you via video chat, and if they determine that Suboxone is right for you, they will prescribe the medication. Visit SuboxoneDoctor.com today to get started on the road to recovery.